Hello, I'm Gregg Meyer, a general internist and primary care physician who now has the privilege of being the president of the community division, as well as the executive vice president for value-based care here at Mass General Brigham. I'm incredibly excited about working with all of you on our home-based care initiatives and integrating that into some of our work in the community division and in value-based care. Thank you for making me part of your home care month. It's especially near and dear to me because I actually started my career as a general practitioner in the National Health Service of the United Kingdom. And there, doing house calls and providing home care was a really important part of my life. And it's been an important part of my life ever since. In many ways, this has been an extraordinary year for Partners Healthcare at Home and for all of us. We acknowledge the fact that you have done an incredible job in responding to the challenges of COVID-19. As of early November, Partners Healthcare at Home has seen over 800 COVID patients. Partners Healthcare at Home has also been incredibly flexible at adapting to the evolving needs of these patients and of our community while implementing infection control measures that keeps both our patients and their caregivers, as well as our own providers, safe throughout this pandemic. All this work is incredibly appreciated. You have made a great difference. I also want to congratulate you on some of the other challenges that you faced this year. There was a major change in Medicare reimbursement. The whole notion of switching over to patient-driven groupings model really changed the way that home care was reimbursed, and you got us through that change without any difficulty. We also know that you have adapted to many of the other challenges that have been going on in our communities. In 2020, Partners Healthcare at Home is celebrating our 20th anniversary, and we're excited to welcome the new change in name and inclusion in the new community division at Mass General Brigham. As a PCP, I can tell you that over these 20 years, I have absolutely benefited from the wonderful care that you've provided for my patients. In addition to that, more personally, I've also benefited from the fact that my own family members have again benefited from your services. There are exciting times ahead. As Mass General Brigham implements its new value-based care strategy, we recognize the extraordinary role that home-based care can play. Home-based care represents a wonderful opportunity to improve outcomes for our patients, to deliver care that is more convenient to them and their caregivers, to do it in a way that provides a better experience for all of them, also allows us to lower costs, and by the way, can make our providers' lives better. That quadruple aim is something that we want to leverage as part of our plans in value-based care, and home-based care and our organization is going to be an important part of that. I want to wish a really heartfelt thanks to all of you for the sacrifices that you've made across this year, over the last 20 years, and rising to the challenges that are ahead of us. We recognize that, again, we are living in extraordinary times. None of us just 11 months ago had planned on providing care in a pandemic, but you rose to the challenge. In addition to that, we recognize that there are a lot of other challenges that all of you have faced. Remote learning, elders at home, not being able to be together for celebrations like this one, and most poignantly, the fact that many of us have family and friends who've succumbed to what is a vicious virus. With all of this, again, let me say that there are extraordinarily exciting times ahead for home-based care and for our organization. I want to thank you for all that you've done this past year, for all that you will be doing, and hope you can enjoy Home Care Month. Thank you.